Okay, good afternoon. I am Jim Candelaria, Montezuma County Commissioner, District 1 Representative. And we're here this afternoon so that we can kind of keep you informed of what's going on in Montezuma County as the coronavirus COVID-19 pandemic changes. We will be providing weekly updates, and we plan on doing them, and you'll have them every Wednesday afternoon. What is the county doing right now? Well, what the county is doing right now is we've reestablished our Emergency Operations Center, and we meet weekly, and that also, along with that, we have our MAT group, which is the Multi-Agency Coordination Group, that allows all of the first responders, the hospital, all of the municipalities, where everybody can share information of what's going on in their jurisdiction, so that we can establish an IAP, an incident action plan for the week. As things change, numbers change, we have to be ready and prepared for those challenges. Right now we have 249 active cases, we have 228 recovered, and we have 4 deaths since this pandemic has started. Okay, one more thing that the Montezuma County Board of County Commissioners has done is that we have agreed to use a portion of the Coronavirus Aid, Relief, and Economic Security Acts received to help local businesses and nonprofit organizations offset business disruptions caused by the COVID-19 virus. All eligible local businesses and nonprofits can apply for grant funding from $500 up to $10,000, and the second round of applications is due by November 30th.
Good afternoon. I am Shak, the Montezuma County Administrator. On behalf of the county, I would like to take the time to thank everybody for being as responsible as they can during this time. We have got questions about, well, where are the active cases? Where are they coming from? At this point, we can say that there are active cases in every municipality within the county and within the unincorporated areas of the county. We as a county want to urge everybody to take personal responsibility for their own actions. We know that it's a politically heated debate when people mention masks. I think, though, that it is imperative that we treat each other with respect. If you happen to be somebody who is wearing a mask and you find yourself encountering those who are not, we would ask that you simply continue to stay 6 feet away from those people and treat them with respect. If you are somebody who is not wearing a mask and you encounter those who are, we would ask that you recognize that they may have a reason for wearing the mask, and that you stay 6 feet away from them, and that you treat those people with respect. It is important that this time that we be able to show equal amounts of compassion to those who may be losing their health or losing a loved one, as well as being able to show compassion for those who have had their livelihoods and businesses interrupted by the response to the COVID issue. And so during this time, when we normally speak about peace on earth and goodwill towards men, we would ask the citizens of this county to rise above, to take responsibility for yourself, wash your hands, keep your surfaces clean, stay away from others, and treat each other with respect. Thank you.
Okay, I'm Tony Suddeth, CEO of Southwest Health, and I just wanted to give you a little bit of update on where things stand today with Southwest. There's been a lot of talk about our capacity and our ability to handle the current COVID crisis, and a lot of focus on the number of beds that's available. And I just wanted to tell you where we are today. And quite honestly, if you look at the total number of beds based on our usual capacity of about 21 patients, our 21 beds available, that it wouldn't look like it was a problem, because we had about 11 patients this morning. That fluctuates hourly, quite honestly, with the number we've had. We've been full at times. We've been down to as low as 7 or 8 patients. We've been keeping about 4 or 5 COVID patients in-house most of the time. And over the past few weeks, we've had to transfer out about 15 COVID patients that came in through our ER and were admitted to our hospital. So we're managing the number of beds. The governor's order last week that he put in place for hospitals required us to increase our capacity by 50%, which we've come up with a plan to do that. We can increase up to 38 beds we moved our OB upstairs. We've done a few things as far as establishing different beds in our upstairs unit, in our old med-surg unit that we used to have. And we've actually even set up where we could have an extra ICU unit or ICU bed in our med-surg area to increase that capacity. Problem we're having right now is, quite honestly, is staffing. COVID's hitting our staff pretty significantly. We've had about 28 staff affected by COVID, and through positive tests or exposures, and we're waiting for testing to make sure they're cleared. But during that time, it restricts our ability to have those staff on site. And so that takes care of our ability, or hampers our ability, to actually be able to take care of patients. So we're working through that. In fact, we had to actually reduce our ICU bed capacity this week down to 2 beds where we normally have 4. So we could move some of those staff into our med-surg unit, less staffing ratio, so they can actually take care of more patients. So we're working through those issues right now, but the staffing is a really big constraint for us right now. And we're trying to get contract individuals from outside, but that's challenging now. It's because most people are having to do that. Other issue is transfers. As I said, we're transferring several people out. Other hospitals are full. We've been regularly having to send patients to Denver because there's nothing regionally available. Although we just recently entered into a collaborative agreement with St. Mary's in Grand Junction, to where as we go forward, we're going to see a position to where we could actually take some of their lower level patients and we could send them some of our higher level patients to try to even out the flow. Obviously, lower level care takes less staff, so that would be very good for us. So we're continuing to work through it. Our ER is extremely busy. We're seeing a lot of COVID patients come through there, which are very time consuming and take a lot of resources. If you've been by our testing center, at pretty much any time it's open, you can see the lines running well out into the road. On Monday, we actually did over 200 tests, which was beyond what we thought we were capable of doing during the time that they were open. But our staff has gotten very efficient, is able to handle a more of a load than they were previously. So we're adjusting as we can. We're doing everything we can to take care of the patients as they come in. But again, the focus is not just on the number of beds available. Doesn't matter if you have 100 beds available if you don't have the staff to staff them, and that's really kind of the constraint that we have right now. So I continue to urge everyone, take precautions. We've got to get this under control, figure out how we can get those numbers down. A 20% positivity rate is not sustainable for this area. It will overwhelm our system at some time, and that's really what we want to focus on at this point. So thank you.
A message from the county is personal responsibility, and we really believe in this. Nobody knows you better than you. You can take care of yourself better than anyone else. So maintain the hand washing, taking care of yourself. The guidelines are all out there. They're set by our public health department, CDC. Personal responsibility goes a long way. And please don't panic. This is not a time to panic at all. Use caution, but please continue to live your lives.